There's a new face in healthcare, and it's changing the way educators train the medical professionals who take care of us all.
We've learned how to do chest tubes, we've learned how to do tracheal intubations, how to start IVs.
Whenever you use the actual SiMCentral, you know, it's just like starting an IV on a real person. You have to talk to them, you have to explain, tell them what you're doing, tell them that it's going to hurt briefly, and they talk back to you so you know actually what the patient will actually be feeling, as if you were going to start an IV on a real patient.
One of the latest technological advances in healthcare is computerized simulation mannequins. It's a 21st century teaching tool for students and professionals alike.
I've been in this business now 40 years, and there were no mannequins 40 years ago. You know, you didn't have the opportunity to practice. You had to actually have a live patient to practice a particular scenario.
Like the aviation industry, the medical industry is now using simulation methods that enable learners at any level to experience real-world medical situations in a safe, controlled environment.
Pilots can be put through some very, very dangerous emergent situations, and if they crash their plane, everybody still walks away, and the simulation equipment's not damaged. The same is true for simulation with medical education. You can take these medical emergencies, you can take these invasive procedures, and residents can practice them.
One thing we get to practice on is code status for a patient. When a patient codes in a hospital, we get to practice those simulations. We get to interact with the nursing team and then also the respiratory therapy team, and then we get to learn our roles as the physician in charge during a code.
In an effort to remain in the forefront of healthcare education, Amarillo College, Texas Tech University Health Sciences Center, and West Texas A&M University are combining resources to establish SiMCentral, which will create a robust learning atmosphere for students of all three entities.
We bring medical students from Texas Tech, from their medical school. We bring nursing students from WT and from AC. And then we bring certain allied health professionals from AC into the simulation center to work out a particular scenario.
And that makes us much stronger to have all three of these institutions working together.
I think the opportunities to expand the curricula for each one of our institutions and the interaction with the other ones will be a fantastic opportunity for the students in the educational environment and in real-world application as they graduate and as they work in the healthcare field.
In a simulation center, we can plan. We have a schedule, and we can say we're going to do a car wreck at 3 p.m. and everybody assembles, gets in the room, they have a written scenario that they follow to get it started, and then from that point on, you have to make it up as you go. And then when it's all over with, they have a big debriefing session where they go in and see what they did right and see what they did wrong.
In addition to providing continuing education opportunities to medical professionals, SiMCentral is also uniquely positioned to offer economic benefits.
If you're a professional, be it a registered nurse or an MD or a paramedic or EMT, this is where you want to come to get the best education you can to keep your licensure current and to provide the best care you can for the patients that you deal with.
Everyone is in some way affected by the healthcare system, whether you're a provider, an educator, or a patient. So it is vital that our community has the finest, most advanced healthcare education laboratory. SiMCentral, where collaboration is a healthy practice.